The last skill we're going to perform is Glasgow Coma Scale Assessment. So first is you need to perform hand washing. Then you need to observe other infections prevention procedures. Then after that is you need to enter to the patient's room and you need to introduce yourself and identify the patient using at least 2 identifiers. Hi ma'am, I'm Hardy Gamad Jr. I'm your nurse today. Before we proceed, may I ask your name and date of your birth? So after that is you need to explain the procedure and explain why it is necessary. Then after that, you need to ascertain the patient's acuity of hearing. And also you need to check the hearing notes for any medical conditions that may affect the accuracy of the GCS. For example, a previous stroke affecting the movements of the patient's arms and also injury to the patients. Then also you need to check the neurological observation chart for the GCS scale. So first, first is you need to we need to proceed into the eye-opening response. So in eye-opening response, so first is you need to assess the eye response. So initially observe the if the patient is opening their eyes spontaneously. So if the patient is opening their eyes spontaneously, your assessment of this behavior is complete. So with the patient score of 4 points. And also you would then move on the assessing a verbal response. So as shown in the next section, if however the patient is not opening their eyes spontaneously, you need to work through the following steps until a response is obtained. So if the patient doesn't open their eyes spontaneously, you need to speak to the patient. So like example, so hey ma'am, are you okay? So if the patient's response and eyes opens in response to the sound so of your voice, they score 3 points. So if the patient doesn't open their eyes in response to sound, so you need to move on the assessing eye opening to pain. So there are different ways of assessing response to pain, but the most common are applying pressure to one of the patient's fingertips. So you need to apply this into the fingertips. So apply, then the patients feel or not the pressure. Then you need to then the other ways is you need to squeeze one of the patient's trapezius muscles known as trapezius squeezes. So squeeze, then pressure. Then next is you need also to apply pressure to the patient's supraorbital knot. So apply. Then, if the patient's eyes in response to a painful stimulus, they score 2 points. Then, if the patients does not open their eyes to a painful stimulus, they score 1 point. And also, if the patients cannot, open their eyes for the reason, so example, or edema, or trauma, or dressing, so you should document that eye response could not be assessment or NT. Then after the eye opening response, next is verbal response. So assessing a patient's verbal response initially involves trying to engage the patient in conversation and assess if they are oriented. So you should score patient based on the highest scoring response. So they demonstrate during the assessment. So some common questions you ask to help the assessment. This might include can you tell me your name, ma'am? So how old are you, ma'am? So do you know where you are at this moment? So also, do you know what the date is today? So that is the some common questions to tell to the patient. So if the patient is able to answer your question appropriately, so the assessment of verbal response is complete. So with the patient scoring of 5 points. So example of this, what is your name, ma'am? So the patient responds immediately. So they response their name or age. Then if the patient is able to reply, so but the response don't seem quite right. So they don't. So example of this, they don't know where they are or what the date. So example of this, example of this, Mama, can you tell me where you are? Then the response is they don't know. So you score 4 points. Then, if the patient is able, then sometimes confusion can be quite subtle. So pay close attention. So pay attention to their responses. So if the patient responds with seemingly random words that are completely unrelated to the questions, so you ask. So this would be class as inappropriate words, and they would score 3 points. So like the example of this, how old are you, ma'am? So the response is changed like that. Then if the patient's making sounds rather than speaking words, example of this is groans. So then this would to be classed as incomprehensible sounds, with the patient scoring 2 points. So if the patient has no intubated or has other factors interfering with their ability to communicate verbally, the response cannot be tested. And for this, you would write not testable. So not testable or NT. So after the verbal response, next is the motor response. So the final part of the GCS, which is GCS assessment involves assessing a patient's motor response. So you should score the patient based on the highest scoring response. So you were able to elicit in any single limb. So example of this, if they were unable to move their right arm, so but able to obey commands with their left arm, so they receive a score of 6 points. So as the patients perform a two-part request. So example of this, so ma'am, can you lift your right arm? So the patient lift their arm of the bed and make a fist. Then make a fist, ma'am. So if the patients follow the command, so you need to write a complete points. So then they would score 6 points and the assessment would be over. So this assessment involves applying. So if they are able to follow the commands correctly, they will score 6 points and the assessment will be over. So this assessment involves applying a painful stimulus and observing the patient's two response. So there are different ways of assessing response to pain, but the most common are the squeezing of the patient's trapezius muscle, known as trapezius squeeze. So squeeze, then apply pressure. So the patients to apply pressure to feel the pain. Then next is you need also to applying the pressure to the patient's supraorbital notch. So apply pressure if the patient feels pain. Then next is you need to, if the patient makes attempts to reach towards the site, so which you are applying a painful stimulus, example in her head or neck, so and brings their hand up above their clavicle. So this would be classed as localizing to pain, with the patient scoring 5 points. So this another possible response to a painful stimulus, which involves the patient trying to withdraw from the pain. So example, the patients to pull their arm away from you when you applying the painful stimulus to their fingertips. So this response is also referred to as a normal flexion response. So as the patient typically flexes their arm rapidly at their elbow to move away from the painful stimulus. So it differs from the abnormal flexion of response to pain. So shown below due to the absence of the other features mentioned. Example, internal rotation of the shoulder. So pronation of the forearm or wrist flexions. Then withdrawal to pain scores 4 points on the Glasgow Coma scales. So in abnormal flexion to painful stimulus typically involves adduction of the arm. So internal rotation of the shoulder, pronation of the forearm, and wrist flexion, so known as the decorticate posturing. So example, I am in a supine position, which is my hand position is like this. That is called decorticate posturing. So which is abnormal into the patient. Then another abnormal is abnormal extension to a painful stimulus, is also known as decebrate posturing. In decebrate posturing, the head is extended. So the head is extended with the arms and legs. Also, the extended and internally rotated. So the patient appears rigid with their teeth clenched. So the signs can be on just one side of the body, on both sides. So the signs may only be present in the upper limbs. So example, my hand is flexed like that. So like that, which is abnormal or decebrating posturings, which is abnormal posturing of the patient. Then the complete absence of motor response to a painful stimulus score 1 point. So if the patient is unable to provide a motor response, example paralysis, so this should be documented are not testable or NT. So and this is the procedure in performing the Glasgow scale assessment. Thank you.